Welcome to the Pharmacist RN, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Okay, we're back. The Pharmacists RN back after a long absence. It's John Papastergiou. Pandemic shut down the podcast for a bit, and it's been on our radar to bring it back, but I was looking for the right partner, and I've got with me Ajit Johal from BC. Ajit, say hello.
How's it going, John? How's it going, everybody? Big fan of the Pharmacists RN. I think it started in 2019, was it? 2018?
Yeah.
Some great episodes, some great features on there, and happy to be a part of this. I think we got some good content lined up, and we're going to help a lot of pharmacists for sure.
Yeah, I think so much has happened since our last episode or segment. I mean, if you think even the profession, how much it's changed during the pandemic. And one of the things, why we went kind of silent or off the air was pharmacists were so busy during the pandemic. You couldn't have time to do something like this. I mean, literally we couldn't get together in a close space in a studio like we are today, but it was just anywhere, any pharmacist across the globe was super busy.
Yeah, it's essential service, John. You can't run a pharmacy without a pharmacist. And then with the lockdowns, the restrictions, and then with the vaccination campaign.
Yeah. Oh, man. And I mean, if I think back to those days, I mean, we had lineups going out the door. It was trying to social distance everyone and do it in a safe environment. And then, I remember when the vaccine came out first, it was kind of a party vibe in Toronto.
It was, yeah. But even before that, remember that first flu season?
Oh, yeah.
That was
wild as well.
yeah, that was.
So you think of what pharmacists have kind of been through and all the goodwill that they've built. Now we're kind of at this, I call it an inflection point. It's like, where do we take it now, right? So where do we go as a profession, build on a lot of that stuff and continue to push forward? I mean, BC's moving pretty quickly though, with scope.
Yeah, I mean, just like you are in Ontario. I mean, you got your minor ailments early 2023, and then we got 21 minor ailments and contraception. So quite a big boost, much overdue boost in our scope of practice in the summer of 2023, and been doing a great job. Just like your colleagues in Ontario here, it's being used. Patients are using it. Patients like it, and it's long overdue.
And we just kind of jumped into it when we went on the air, but I didn't even really introduce you. I know everyone in BC knows you, and I think a lot of pharmacists across Canada know you, but maybe just talk a little bit about your background, because it's very unique. You found a nice niche for yourself, both in like practice and in education and everything else.
Yeah, no, totally, John. So I actually, my pharmacy roots are in Ontario. So I graduated from the Leslie Dan Faculty of Pharmaceutical Sciences, and as you agree, best school in Canada, right? Yeah.
Oh, yeah.
So I'm a 1T2, and I remember actually back when I started pharmacy school and those 4 years I was going, I heard a lot about the point of care testing you were doing.
Yeah, I was getting a lot of momentum even back, where it's come now, it's a whole other thing. But I remember back then, we were getting a lot of pushback from stakeholders, regulators. Hey, should we be doing this? And we just kind of pushed forward because we knew it was going to add value. We're going to do an episode on that somewhere down the line, because where that's come and the tech and everything else, it really is the future. Globally, it's being picked up as well. So because I was 02, so you came a little bit after me there. Yeah.
I did, yeah. So class of 1T2, and then immediately after I graduated, I'm born and raised in BC, and I come from a long line of pharmacists. So my father is a pharmacist, pharmacy owner. He's had a couple stores now for, at least a decade, maybe more. And so I immediately came back. Actually, interestingly enough, his independents actually were fully staffed. So he said, go work for Shoppers and, learn the ropes, become the next John Papastergiou. But he actually acquired a new store back in 2011, and he's like, now, okay, I guess we can hire you. So one of the great things about family business is, you can actually ask for forgiveness and not permission. So fortunately for me, and I always tell this story, back in 2012, when I started, pharmacists in BC were big in the immunization space. So we were hot off the heels of the H1N1 pandemic, where pharmacists were provided scope to provide not just flu vaccines. And this is where they did it right. This is where they did it right with the Schedule 2 vaccination, where it's like any vaccine with a guideline, you can do it independently.
Yeah, so we'll probably get to talking about that, but that's put up such barriers for us here in Ontario, whether a vaccine schedule 1 or 2. And even now when it's schedule 2, there's not a lot of clarity with respect to what you can do, you know?
The clarity isn't there like it is in BC. And even for BC pharmacists, if you're tuning in from BC, because this is a global podcast, but the college just reissued a clarification on that. The last one was in 2013, and they just reissued it because they're getting so many questions. Can I do this without a prescription? Do I need a prescription? And to clarify, actually, to set the record straight, is all vaccines in BC are Schedule 2. You just need to justify it with a guideline. So you assess your patient, and as long as there's a reputable guideline that says vaccines recommended, which is what most clinicians use, right?
Sure.
We're not doing anything off-label here. And that's all you need, but it's that sort of latitude and gray area and freedom that I think we need to embrace as pharmacy.
Yeah, even if we had the universal schedules, right? It's so confusing province to province. And even here, like I said, I have to look it up still. So, and I do a lot in the vaccination space. Sometimes I forget, is this 1 or 2? You ask my pharmacist, pharmacists aren't sure. I'm like, and you got a patient waiting there, right?
Well, it's in Ontario, you could have the same patient that you could vaccinate. You could recommend some evidence-based vaccines. And then you could say, oh, I can do this one, but you got to get a prescription for this one and this one. Or you could have a couple. And that's the big thing I've been finding is pharmacist-led immunization. What we do in our pharmacy practice is a lot of couples get vaccinated when if they didn't have the same family doctor, that definitely wouldn't happen.
Yeah.
So barriers to vaccinations for sure. But obviously, as we're going on about this, my interest is in vaccination. I started with a travel medicine clinic, and in BC, the other great thing we have, and hopefully Ontario will get here as well, is we're plugged into school-based programs. Okay. So MMR, measles, mumps, rubella, I vaccinate a lot against that, especially now we're seeing issues with immunization gaps, low uptake rates. But yeah, it's the full court press of immunization. So I got really involved in that and started working at UBC. I coordinated the first travel medicine focus course in Canada and been doing a lot of continuing education with KOLs like yourself to really highlight that. Honestly, John, like this space, pharmacists can really have a huge impact, not just in vaccination, but longitudinal management, chronic disease management, if you are the go-to for vaccination.
Absolutely. I do a lot of speaking globally as well. And, I don't think Canadian pharmacists realize how when you go abroad, other pharmacy groups across the globe look to us as an example.
Totally.
Right?
Oh, yeah.
And I know we've been to global conferences together and they're looking, what has Canada done? And have you gone there? And I say the same thing to everyone. It starts with flu. If you do a good job with flu, you take over vaccination, and then that's going to open up a whole bunch of doors for you. And I think, it's almost routine for us now, but the amount of work we did to get here was substantial. And it took we're at 10 years of vaccinating now.
You are, yeah.
Yeah. So it took a while. And I think, it's fitting that, your background is in immunization. And I think, what we wanted to talk about in our kind of first segment back after the pandemic is, although we're doing a great job, the pandemic created a lot of gaps to care, right? And especially in the immunization space, and particularly in one with the schools closed.
Oh, yeah.
Right?
Yeah.
And that's what we wanted to talk about with you here today, for sure.
Yeah. So you mentioned like it starts with flu and then it opens up a whole bunch of doors. And today in this episode, the door we're going to open is human papillomavirus.
Yeah.
So HPV. So, honestly, like human papillomavirus is a virus. It's a cancer-causing virus. It infects, it persists, and it can cause changes in the way cells communicate, the way they divide. And when they divide out of control, it causes cancer.
And I still think that message is, and I know we spent a lot of time doing programs where we try to educate on this, but that message is not completely out there, even amongst good, well-intentioned frontline community pharmacists.
Oh my God. Yeah. It's interesting because now both boys and girls get vaccinated in school-based programs. It's a gender-neutral vaccine. Boys, it's been delayed substantially. It just shows the common trend is like, we've always underestimated this virus. So like the guy who won the Nobel Prize for discovering the link between HPV and cancer is a German scientist named Dr. Harold Zurhausen. See, I got all the fun trivia on the podcast.
Yeah.
He discovered it in like the 70s or the 80s, but he didn't win a Nobel Prize till 2008. So we knew this virus caused cancer. We didn't recognize that till years later. So it always starts like, I was never vaccinated for HPV in school. I got my vaccine as an adult, and we'll get to that maybe in the second episode on adult HPV vaccination. But my own personal story, my own foray into HPV is actually my cousin. She was, I think, so they, in BC, I think it's the same in Ontario, they do the HPV vaccine in grade 6 in BC.
Yep.
So I think it's 6 or 7.
Yeah, it's right now they're doing it in grade 7 here. Yeah.
Yeah, so grade 7. And to your point about school closures, there's been a lot of people who are missed.
Oh, total.
Yeah.
Yeah, it's funny you said, my daughter's in grade 7 and she just got her second dose yesterday.
That's
so
great.
But there would have been a cohort there that was entirely missed, right?
Yep,
right before her, actually.
Definitely. So to get back to my story, my cousin, we were at this like family barbecue and we're talking about school vaccinations. And my aunt told me that they opted her out of HPV vaccination. So, I'm a pharmacist. My dad's a pharmacist, high health literacy, scientific literacy. But we have like someone in our immediate family who opted their child out of HPV vaccination. And I was like, oh, well, why would you do that? And she said, oh, we didn't think she needed it at the time. And it's interesting because like there was a study done almost 2 decades ago, maybe 15 years ago, where the most common reason why parents opt their kids out is they just don't want to think about it right now.
Yeah.
Because to your point, that message just still isn't out there, right? Yeah. Like if no one questions, oh yeah, meningitis, yeah, okay.
Yeah.
Pertussis, tetanus, people immediately associate that with like, oh yeah, those are bad diseases. But HPV, it's like, isn't that like a sex thing?
Yes, exactly.
Like I don't think my kid needs to worry about them now. I think they'll just get married and, not, do it. It's just like, so yeah, it's like, and then I talked to my neighbor, and then you see this sort of, we call it the confirmation bias. Yeah. So someone has this cognitive dissonance where they, should I do this for my kid or not? And then they talk to someone who's not knowledgeable at all, but as long as they confirm what they're thinking,
absolutely,
it's like, okay.
Listen, man, if you're a pharmacist, you live that every day. I still go out to the aisle and there's a customer, hey, is this good for cough and cold? And I'm like, you know what? What are your symptoms? Yeah. Based on I suggest this one. And then there'll be another customer in the aisle. I go, I really like the one you got. And I'm just going to take this one. They do that all the time. It drives me crazy.
Oh, actually. Yeah. It's human psychology. So,
so that's part of it for sure. Wait, what are you finding in practice with respect to post-pandemic now? Mm-hmm. So we've had all this focus on vaccination, immunization, get your booster, get this, get that. Everyone is kind of vaxxed out. What does this mean for all these other vaccines now that we're not only trying to get back on track with, but also trying to play catch up? Right?
Oh, yeah. I think it's, I like to see opportunity in all this. And I think there is this talk of vaccine fatigue. I think a lot of that has to do with COVID. Yeah. And that fatigue also has to do with lockdowns. Like people are tired of the word COVID. And when it comes to the opportunity, though, I think people are aware that vaccines work and these diseases are very real. And unfortunately, with all of the focus we put on mitigating COVID, it's come at the cost of other vaccination rates like measles, right? Where, we need high vaccination rates to sustain our elimination status, right? It's very contagious and it will come back if you see that drop. So I think like there's an opportunity both to talk about vaccinations, but also for pharmacists too, to play a bigger role. Because if you look at the vaccine uptake rates for COVID, like 80%, almost 90% of Canadians, especially in BC, but all over high uptake rate for at least 2 doses.
Yeah.
And most of them got it from a pharmacy.
Absolutely.
Yeah.
Where we've dropped off now is on the boosters, right? Yeah. But the initial vaccination rate was super, super high. And, it's easy for us to sit here kind of in studio and talk about, okay, yeah, we pharmacists could do more and should do more. And, we've done this work through the Ontario Pharmacy Evidence Network, we call it now, where we actually surveyed pharmacists out in the community. And this was in the early days when we got scope and we asked them, what are those facilitators and what are the barriers? And it hasn't changed at all. Facilitators are always the same. They're well-intentioned. They want to do more, feel that gives them a competitive advantage. They want to showcase new skills, promote public health. The barriers are also always the same. Time and workflow. I got all this stuff going on already in my day. If I go down that rabbit hole of bringing up, and especially when we're talking about HPV, it could be a quick discussion, or it could be a 30-minute discussion with a parent or a young adult. And you're in there and they're afraid of that sometimes, right?
Yeah.
And what do you say to that? Like, what, that frontline pharmacist that goes, I've got 10 prescriptions to check. I'm doing minor ailments. I've got people asking questions, waiting for vaccines. And now I've got, a mom that's going to ask all these questions about, HPV, and they're reluctant sometimes to do that.
Oh, yeah. And I think that, that's where a lot of these educational programs for HCPs helps. If you feel confident about something, you portray that confidence where you can communicate it quickly, right? Your patients trust you. Like your patient, you always talk about how your patients trust you. My patients trust me. And, ultimately we're doing things that's best for their health. I think from a healthcare provider's perspective, we do need to be respectful of their time. We're both frontline pharmacists. I would never ask a pharmacist to give somebody a 30-minute HPV vaccination lecture. And I certainly didn't do the same thing for my cousin. But I think understanding a few things is really important. So the first thing is obviously HPV is a virus that causes cancer. So it's a virus that is quite ubiquitous. When we look at the prevalence of HPV, we see, and the numbers do vary, I think Canadian statistics say 70%, up to some other statistics say up to 90%. Of males and females who are sexually active, and we'll get into what that means in a little bit, will be exposed to this virus across their lifespan. So when you actually look at it, it's like, okay, a virus that causes cancer, a virus that is perhaps the sole cause of something like cervical cancer and causes 70% or more of head and neck related cancers. What tools do we have available to prevent cancer with a vaccine? Yeah. So it's a virus that causes cancer, and therefore it's a cancer preventing vaccine. And simple words like that is enough to get somebody's attention.
Night and day, I think.
Totally.
Compared to kind of the terminology where we were using or in the early days, and this idea that it was a vaccine only for girls too, that still persists out there as well. Like, it's why I bring up my daughter again, but today we're getting vaccinated yesterday, and I asked her, I said, were all the kids getting vaccinated? And what she said to me was, a few boys didn't get permission. Mm-hmm. So I think that's out there that, stood out to me, that the boys are the ones that are being opted out. Right?
Which is really unfortunate, because when we actually look at epidemiological data, HPV-related cervical cancer is on the decline because we got good vaccination, and we also have good screening for that. Yeah. And actually, BC, and I think Alberta is probably doing the same, Ontario will probably get there at some point, is we're not doing invasive Pap tests anymore. We're doing HPV point-of-care screening. To your point, point of care.
It's coming. I know we were talking about this yesterday. It's coming. I think it's going to be big in pharmacies.
Oh, yeah. Yeah. And the biggest thing about it is whether someone's HPV positive or negative, always ask them about their vaccination status. Yeah. Because it's a virus, I can't see it. And unlike other sexually transmitted infections, there's no test of cure. There's no reporting. It's just out there. Yeah. Right?
Yeah,
it's just
absolutely. Out there. Yeah. No, I think, like to your point, this role for us is to continue to expand. So, we're talking about some of the barriers. We're talking about the challenges. The reality is, I think pharmacists are good at managing a lot of things. We're effective. We want to keep these interactions short, but positive and engaging. Yep. So if you were, empowering. Yeah. So if you were going to say, okay, these are like my top 3 things that I'd want to get to community pharmacists about HPV, what would those be?
So my top 3 would be just the conversation. Is that one line, the virus that causes cancer, I'm concerned about your health, and it's a cancer preventing vaccine. The second is definitely understand that this is a virus that infects across the lifespan. So the best time to get it is as soon as possible. So in that school-based program, but there's also catch-up programs, and it's also vaccine for adults as well. And especially when you talk about catch-up, we look at males. Right? Males were missed in the program, and you've done some programs with some dentists, some dental professionals, and this is scary stuff. Like the head and neck cancer.
Oh man.
It's scary.
Yeah. And a lot of every time they partner us up when we do these interdisciplinary things for HPV, it's the only time you'll see the head and neck oncologists and surgeons as part of an advisory board. And they're always the most captivating because they start telling these stories about what it means to live with this disease. And if people heard that, they would get vaccinated.
Let's just give our audience some context. So we talked about how HPV infects, persists, and causes cancer. So Another area where HPV can cause cancer, infecting and persisting, is in the oropharyngeal region, which is if you look at if you slice your head down to the back third, you see that area there. Really scary stuff because, as I was saying, cervical cancer is going down, but head and neck related cancers are going up. And they're going up at an astronomical rate, 3 times higher in males than females. It's crazy.
And then these patients, what they have to live with, the consequences, suicide rates, like the stuff they talk about is pretty scary.
It's so scary. So it all starts with actually identifying the cancer late. Because with cervical cancer, we've got Pap tests where we can get precancerous lesions, right? So we can see a cell that's potentially going to go that way, and you can intervene. Yeah. It's not fun. It's not a good journey to go on, but it's not nearly as bad as the head and neck journey. But when it comes to head and neck related cancers, if you actually, we're in the studio right now, if you kind of palpate your head and neck area, if you feel something squishy, that's like a lymph node. Yeah. But if that's hard and it's fixed, that needs to be looked at. Yeah. So dental professionals, the chief dental officer in 2020 did this massive State of the Union alarm to say dentists need to screen for this because the problem with head and neck cancer is there's no early detection. So once it's identified, it's usually a mass, and you got to do radiation to the whole head and neck area. And that's where you run into the issues. And that radiation to the head and neck area is brutal. The side effects are awful. You be swallowing, if you look at anecdotes from patients, that's where you're on those advisory boards where you hear those stories. And that's not the end of it. If you actually see after somebody, because you have to irradiate the whole head and neck area, dental reconstruction. Yeah. Oh my God. There's even one of the things, actually, I was telling my wife this over dinner, and she couldn't eat her food afterwards, which I know is terrible. Yeah. It's terrible. And not a good thing to do. I don't recommend that for our audience, but because of the surgery that needs to be done, cutting parts of the tongue off to prevent spread, a lot of times they use to graft the tongue back. They use a piece of the forearm. And some, my forearms, I don't know about yours, I got some hair on my forearms. Yeah. They don't have time to shave it. So you actually show pictures of hair in someone's mouth. And it's
But this is the type of stuff we hear when we go to these events. And it opens your eyes that the solution is pretty simple. Let's get these people vaccinated.
Well, that's just it. That was actually my story of getting vaccinated for HPV happened a few years ago. And the guy who called me was my good high school friend, a psychiatrist who was doing his fellowship in psycho-oncology. So he was seeing the psychological morbidity, suicide rates in these young male patients, our age demographic, in the prime of their lives, suffering not from the actual cancer, but the morbidity that the treatment to cure it, right? So he was very adamant. He's I need to get vaccinated. You should get vaccinated. Tell everyone you know. And at the end of all the programs, it always says, protect yourselves, protect your family, protect your pharmacy team. Yeah. Right? It's like cancer prevention. Take that. It's worth its weight in gold. So totally.
Yeah. And, we didn't want to make our first episode back the most depressing episode ever. So, we'll switch gears a little bit. And I know we're going a little long on time here, but so we talked about, three more things. With respect to the vaccine, what are those myths you'd want to bust, or what are those,
How much time do you have?
Yeah, I know that we could talk all day, but what are those therapeutic pearls, I call them? 3 things pharmacists should know. I mean, we know the vaccine works and it's safe. We know that now. Those are no-brainers. It's been around for a long time. Millions and millions of doses given. Anything else?
Almost 500 million. Half a billion, yeah.
So anything on top, what would you say?
Oh, honestly, John, I think that would make up 2 of my 3. So I think the big thing is, the 3 things you want to address in any vaccine conversation is it safe? Is it effective? And how do I get it? Yeah. Right? So is it safe? Absolutely. It's probably the most studied vaccine of all time. The World Health Organization has prompted, global safety surveillance for this vaccine. Over 500 million doses given to date. The vaccine's been around since 2006. It doesn't really carry I always tell patients what are the side effects. It's a little bit painful on administration. I don't know if you've heard that from some people. So, it's a little bit painful for a few minutes after, but other than that, it's pretty well tolerated. It's very effective. And in the next episode, I'll get into the immune response on how your body naturally makes the immune response against HPV versus how the vaccine does it. But vaccine does it so well because we don't do it well naturally.
That's right.
No breakthrough cases.
That's amazing.
No breakthrough cases. If you look at cohorts that were vaccinated, there was one recent study in Scotland. Well, all the things we cite, we'll put links in the notes section of the episode. No cases, 2008 cohort, and they've been followed to this time.
That's wild if you think about that. And when you think about a therapy being effective,
oh, geez, yeah,
0 cases. If we tried to compare that to lipid reduction with statins or some of this other stuff,
too many variables, right?
That's right.
Yeah, too many variables.
You know, we've got a therapy that works well, and that works for cancer.
Yeah.
I mean, and this is why we selected this topic as our first one coming back, because we think pharmacists can have a huge impact. We got to continue doing what we're doing and build on it. And I know we could spend other episodes talking about, okay, how do we operationalize this and what's being done in community pharmacies to free up the time? Because there's a lot behind the scenes right now. And I think
totally.
Pharmacy practice, the way it looks now, is dramatically different than the way it looked 5-6 years ago. And it's going to be dramatically different in the next 5 or 6 years. And I think some of our goal with this podcast is not only to talk about therapeutic topics, but talk about some of that innovation that's going on, and maybe even bring in some people that can help, give us some insight to what's coming down the pipeline. Because there's a lot of cool things. But one of the goals we've set for ourselves is not to go too long with the individual segments. We want people to come back and listen to others. So I hope we had a really short, succinct kind of introduction to HPV. But I think in our next segment, we'll explore it in a little bit more depth.
Definitely. We'll definitely explore it into a lot more depth in terms of the clinical and especially implementation. But I forgot my third one.
Oh, yeah.
So I talked about vaccine is safe. Vaccine is very effective. Cancer prevention, right? The third one is how do you access it? And, this one's a little bit tricky because certain people have it funded.
Yeah. Oh.
And, you know what I mean? So it's like, do I qualify for a school-based catch-up? And hopefully Ontario pharmacists will be more involved in that. And hopefully we'll see broader ages for it. But the National Advisory Committee on Immunization has no upper age limit on this vaccine. Yeah. And I've been seeing, I work with a lot of employers. Yeah. A lot of benefits plans are covering HPV vaccination. So is it covered under your benefits? It's a no-brainer. It's a no-brainer. So there's a lot of value when you look at the context of cancer prevention. And if you look at other types of cancer you can prevent, lung cancer with smoking cessation, that's a lifelong thing. That's a behavioral change. And then skin cancer with sunscreen. And most people under-apply, and probably you under-apply too, John. You know what I mean? Like, it's such a pain applying sunscreen. And you're supposed to wear it like all the time.
Yeah.
It's crazy.
Because we're dark skinned. I mean, think about it that much, but it should be everyone. Smoking cessation is a whole other discussion. I mean, we've got funding here in Ontario. Hardly anyone accesses it. I mean, it's one of those examples I bring up all the time. It's there, but the way the program was set up makes it so difficult at the community pharmacy level that it's almost been abandoned. And that's this idea that funding alone doesn't mean we're going to use something, right? Well,
even the funding doesn't respect the longitudinal importance of sustained quitting. Like, you do talks on COPD. You can't be intermittent quitting. You can't just get free NRT for 3 months and be like, okay, I'm going to start smoking after that's done. So yeah, you have a very powerful 3 shots. If you're an adult over 50, if you're over 15, it's 3 doses, 3 shots, 45 minutes.
That's it.
Yeah, that's it. Cancer prevention. One type of cancer out of the equation.
We're gonna end it on that. It's great to be back. Pharmacists are in. We're gonna come back with a second episode on this, because you can see it's easy to get off topic and go on, because this is such an important topic. And I think a lot of the pros we take back from HPV, we can apply to other vaccines as well. So we'll be back with another segment and we'll try to expand on this.
Sounds good. Looking forward to it. Till next time, John.